Chris Walker, Emergency Coordinator at the Hamilton County Health Department. Good morning, sir.
Morning, Tammy. How are you?
I'm good. We saw a big jump in cases on Saturday, though. 55 new cases for Hamilton County. What's that all about?
So we did see a big jump in cases, and I think there's a couple different factors. Number one, we did have the State Department of Health, IU, Fairbanks School of Public Health testing site at Ivy Tech in Noblesville, where they accomplished over 400 tests in 4 days. So I think we saw a lot of people that may have been asymptomatic show up as positive cases as a part of that testing. And as well, as we bring on more testing capabilities, more people get tested and more people find out that they're positive. But the thing to remember is 80% of these folks, even if they have symptoms, do not require medical interventions. So there may be a lot of people that are asymptomatic or just have mild symptoms and never feel the need to go get tested because it could just be they may be dismissing it as allergies or the common cold or something like that. And again, testing is coming up that's more prevalent, so we're finding it more and more. I don't think it's anything to be terribly concerned about. Yesterday we were back down to 14 positive cases. I mean, we're gonna have good days and bad days here as people go forward. So I don't think it was anything terribly alarming.
To that end, you're talking about testing. The Indiana State Department of Health is offering 5 drive-through testing clinics this week, but none in or near Hamilton County. That may change soon, though.
That's correct. So they're doing 5 more mobile testing sites because the Fairbanks study that they are doing with IU did not get the turnout they were expecting. They were looking for 5,000 people in the state to participate in that, and their numbers were kind of low. So they had to extend the testing for that study a little bit longer than they had anticipated. However, we were told late last week that we will be receiving one of the ISDH testing sites that the governor and Dr. Box have been speaking about since I believe about Wednesday or so. And we are working on planning where that location is going to be, writing up the plans for that, and finalizing everything. We expect that to be finalized probably by the end of next week and possibly ready to go as early as the following week. So right after Mother's Day.
And who's eligible to get a test at one of these drive-through clinics?
So the sites we're looking at are not drive-throughs. These are going to be by appointment. You have to go online, and we'll make sure we put out the information with State Department of Health when that becomes available. You do the questionnaire online, and it will tell you if you're eligible for a test or not. Dr. Box has written a standing order which covers every Hoosier that if you meet the criteria, you go get tested. So you'll do the online application. It'll help you schedule your appointment, tell you where to go, and then the testing site will know that you're coming and will be prepared for you to be there.
Governor Holcomb's Back on Track plan allows restaurants and retail to open at 50% capacity today. How does that change the work that you're doing at the health department? Because now you've suddenly got restaurants that are going to need inspecting.
Right. Well, we've continued to work with the restaurants throughout this process to make sure they're doing what they can to safeguard the residents. Last week, our environmental department sent out a lot of material to restaurants, advising them for additional measures to safeguard the staff and the clientele as they do open back up. We do expect to probably get some phone calls with more questions and concerns in the days and weeks ahead as we go further and further down the road here. But the big thing I think everyone needs to keep in mind is Governor Holcomb said so well is that we're really testing the waters as we go. And at any point, we may see a spike that we need to take a step back and pause and reevaluate what we're doing. And that's not just food services. That's our daily lives in general.
Well, you said testing the waters. I'll ask you about pool inspections. It's getting warm outside. I don't know that most people know, but the health department is the one responsible for inspecting pools. What's the latest on that? Do we know?
Well, then that's true. We do inspect the pools. I know our pools folks are working on it. They're working on the guidance and going through the guidance to see what guidance we need to put out for the pools, the local pools, the public pools, things like that. so that they can safeguard their residents. And right now, I think they're still compiling that information, getting ready to push it out.
Just last week, we started releasing numbers for deaths at long-term care facilities. That's actually something that the State Department of Health had not decided to do yet, but I know that we thought that was pretty important in Hamilton County. Can you explain why we made that decision?
Sure. The information is public record, number one. You know, a person that's alive is covered by HIPAA. Unfortunately, when you do die, your HIPAA rights expire, and people can request public health or public information to a degree. In that regard, we've also had a lot of concerns in the municipalities and from family members about those long-term care facilities. And we thought it was prudent to push that information out. We have 23 healthcare or long-term care centers in Hamilton County, and you know, they're doing everything they can. They're doing yeoman's work and they have difficult work to do under the best of circumstances, and now they're doing them during crisis circumstances. They're doing a great job, and unfortunately, you know, this was going to happen at some point, and they're doing a great work. But we felt it was important for the public and the families to know, and it gives them another data point to see the hard work that they're doing. So we thought it was prudent to push that out to everybody.
Finally, one last question. The City of Fishers voted to create its own health department a couple weeks back. Since then, there's been some confusion, and I know we're still trying to figure out exactly the division of labor there. Can you kind of bring us up to date with where you guys are at with that?
Sure. As you said, it was a very short notice thing, and we weren't really prepared to divvy up the workload the way we've had to. But as it stands right now, there are still a number of unincorporated areas within Fishers, specific neighborhoods, specific sections of the townships, Delaware Township and Fall Creek Township. They're not truly incorporated into Fishers. Those folks still can call us and rely on us to provide the services that we've provided for over 50 years. And they can reach out to us, like I said, either by calling the office, 317-776-8500, or emailing us at health@hamiltoncounty.in.gov. And if you live in the incorporated areas of Fishers, you will need to contact the Fishers Health Department for your public health needs.
And you can find the contact information online. I did look at it.
That's correct. It is on their website, yes.
Fantastic. Anything else you want to add? I didn't ask. Anything to consider as we move through the week ahead?
Well, I think the big thing to keep reiterating to folks is, even though we're starting to get back to the new normal, we need to maintain good social distancing, do good things to safeguard ourselves. And remember, we're wearing the mask to protect other people, not protect ourselves. So wearing is caring.
Great. Thanks, Chris. We appreciate your time. Best of luck this week.
Thanks. Have a great week.
You too.